all of us have biofeedback, and haptics is internally built in our own system with the touch, vibration, temperature, everything. Auditory and visual, we don't need a special additional feedback. So for me, when you think about a robot, what it is supposed to do or assist in us, one, it should give us the accuracy, how close it is to the true value, and it should be repeatable. That is what is the precision, and better execution with an efficient way. And you have to minimize the human error. These are the things which we think about a robot, that's what we expect. So with the non-haptic robots, yes, you can have a imageless or image-based surgeries. The learning curve will be very small because you don't have to learn something new which you have to add to your workflow. And you're always happy cutting by yourself rather than taking up, giving it to someone else. And when it comes to non-haptic, it is completely under the surgeon control. Surgeon-centered most of the time when it comes to, I'm talking more about the ROSA system here, it adapts with the surgeon's workflow very easily. Learning curve will be very short and allows to use multiple techniques. You can see the use of personalized alignment or gap balancing or measuration or hybrid techniques. You can use various implants of your choice that allows you to choose. Real-time feedback is available in most of the systems. You can assess the soft tissue balance and the movements. Based on that, you can change or readjust the mechanics. And again, here, it is your personal haptic system which is going to be more useful. Real-time feedback, again, in component alignment and limb alignment, which you can see in all of the systems. And I don't think there's any superiority in any of the systems. Non-haptic bone cuts, again, it is the surgeon's biofeedback. And yes, the main concern when it comes to haptics and non-haptics is if you're going to damage the soft tissue. And for a careful surgeon, if you place your retractors correctly and choose your correct saw blade, the chance of having any soft tissue injury is very unlikely. And certainly with most of the studies have shown with the robotics, the precision and accuracy is improved. Your outliers are reduced significantly. This study, particularly based on a ROSA system, has shown that the average planned or validated or measured angles are within an acceptable limit. So does non-haptic robot give you a precision cut? Yes, we can check it by using manual techniques as well. How much have you really cut? Even if you do a recut, for example, 1 mm recut, you can clearly measure that you got only 1 mm. And did we achieve the accuracy, precision, efficiency, and execution correctly? And minimize the error? Yes, yes to all. So for me, a robotic system, a non-haptic or haptic, should be something which is very simple, easily adaptable, and you can choose your implant of choice, the technique of choice, and you should get your alignments with minimum outliers. Thank you.